Welcome viewers to our deep dive into the world of ultrasonography.
Hello everyone, and welcome to this educational session where we will delve into the critical topic of subchorionic hemorrhage, SCH, in the first trimester of pregnancy, as visualized through ultrasound. SCH is defined as the accumulation of blood between the chorion, a membrane surrounding the embryo, and the uterine wall. On ultrasound, SCH typically appears as a crescent-shaped fluid collection, often situated around the gestational sac. This condition is a significant finding in early pregnancy and displays considerable variation in size and appearance. While the majority of pregnancies with SCH progress without serious complications, especially when the hemorrhage is small. Larger SCHs, those that cover more than 30% of the gestational sac, are associated with a higher risk of adverse outcomes, such as miscarriage. Transvaginal ultrasound is essential for evaluating SCH in early pregnancy due to its proximity to pelvic structures, high-resolution imaging, and ability to clearly visualize small details like the gestational sac. Characteristics of SCH on ultrasound include: location. SCH is located between the chorionic membrane and the wall of the uterus, often seen adjacent to the gestational sac. Size. The size of SCH can vary significantly, from small crescentic collections to larger masses that surround a significant portion of the gestational sac. Sonographic appearance. SCH generally appears as a crescent-shaped hypoechoic or hyperechoic area adjacent to the gestational sac. The appearance depends on the age of the hemorrhage, with fresher hemorrhages being more echogenic due to active bleeding, and older ones appearing more hypoechoic, as the blood starts to clot and resolve. Color Doppler. This can be used to differentiate SCH from other vascular structures or pathologies like chorionic hemangioma or placental lakes. By confirming the absence of blood flow within the hemorrhage, Color Doppler helps affirm the diagnosis of SCH rather than a potentially misdiagnosed vascular anomaly. Understanding the differences between subchorionic hemorrhage, threatened miscarriage, and placental abruption is crucial for accurate diagnosis and appropriate management. In a threatened miscarriage, ultrasound might show a gestational sac that appears normal or exhibits abnormalities such as an irregular shape or an embryo with a slowed or undetectable heartbeat, signaling possible miscarriage and questioning the pregnancy's viability. Unlike SCH, a threatened miscarriage doesn't always involve a visible hematoma unless it coincides with SCH. Placental abruption. This condition is characterized by the premature separation of the placenta from the uterine wall. Ultrasound may show a retroplacental clot which appears as a thickened, hypoechoic area behind the placenta. However, small abruptions might not be visible on ultrasound. Placental abruption typically presents with sudden onset of painful vaginal bleeding, abdominal pain, and could be associated with fetal distress, depending on the severity of the abruption. This is a potentially life-threatening condition requiring immediate medical attention. The preplacental hematoma, depicted at the bottom left, lies in front of the placenta and may not be as clinically significant as a retroplacental hematoma but still requires careful evaluation.
Dive into the captivating world of ultrasonography in just a few seconds. Hit subscribe and boost your ultrasonography expertise.